Hi, my name is KRISHNAN. I represent a company called Marks Biotech. We are the partners for global leaders in the image guided navigation solution, KRISHNAN, Canada. Today you see in image guided navigation, semi-robotic devices and robotic devices. Most of the companies which they use robotics in the field in healthcare are from a basic manufacturer, an OEM and a pioneer in the field is KRISHNAN, Canada. So right now I'm going to show you a concept which is image guided navigation. Let us come to the product right now. So here you see a camera. This is actually a system which is called Navident system. This Navident system this is a device used for dentistry. The cameras are used in multiple industry in healthcare, in spine, cranial, ENT, orthopedic and other industries also. Right now we are going to talk about Navident, which is in dentistry. Here this is a camera. We have two different types of Navident devices. We have a static camera and a dynamic camera over here. This is a static camera where you need to change the position of the camera based on the clinical protocol. But this system both works on a software and a hardware. But this is an advanced version of a camera where dynamically based on the patient movement and the surgeon's hand movement, the camera will automatically able to rotate. So here the concept here is we are talking about is image guided navigation. So today we need to have a base source data. What you require in order to use this device is a CBCT data only. So this technology what we are talking about is basically related to dentistry in image guided navigation for different multiple indication related to guided endodontics, image guided navigation, implantology, full mouth rehab, immediate extraction placement of implant, sinus lip procedures, zygomatic implant, pterygoid implant, multiple indication you can actually use here. Let me explain how this concept and a protocol works here. As I actually said to you, what you require is a minimum CBCT data. Just a file is required from your CBCT center. If you have a CBCT in-house, is great, and that is a minimum data required, where you are able to import the CBCT data in this file. This is a software from KRISHNAN where it is a in-house. The system provides a software which is completely a generic version of the software. You do not need any software for surgical protocol. There is no library required for implant placement. Any implant system, any type, whatever design, thread design it is one software open-ended system. And this software, you are importing a data here, your DICOM data. Then after that, what happens is you are importing the data. You can plan your implant placement virtually here in the software. Then after, once the implant is planned, then what happens is the first step here is patient registration. When you're talking about patient registration, the system first confirms as a protocol that is the CBCT data loaded is of the same patient. In order to confirm that, we take some 3 landmarks on the software. We identify 3 landmarks in the patient oral cavity in the software. The same 3 landmarks, it is also identically same position. We rub with the tracer in the mannequin or the patient here. The next step, once both the system is merging, then we come to any device what you're going to get it into the system is a calibrator. This is a tiny device, a calibrator, and any instrument what you're drilling into the patient oral cavity, use a calibrator. I'm going to show you how this works. So this is a calibrator. This drill I'm planning to use it for placing an implant. So I am just calibrating this tip. The tip is calibrated. It hardly taken about 5 seconds for the tip to calibrate. If I want to again show to you, it actually just take 5 seconds for the calibration of the device. So once the device is calibrated, these black and white checkerboard markers are the identification for the camera to see the hand movement of the surgeon. Then I am coming over here. In this case, it is a mandible case. So I am getting into the oral cavity. You see the screen, I am getting it here. You can also watch the screen. The screen give you multiple options related to buccolingual, musodistal and the OPG view. Our goal here is to see to that we are getting into the bullseye target view. So when I am drilling into the osteotomy, here you see the 3 numbers there. The first one what you see 0.5, I am about 0.5 away from the osteotomy side. I am just less than 0.3 degree variance from the treatment plan, and right now I am drilling it into the bullseye. So I need to drill further, which is about 2.8 millimeter to reach the osteotomy. You see this when I am drilling it here, the green changes to yellow and yellow changes to red. So red denotes that I have planned whatever 12 millimeters of implant what I placed, which is already achieved. Say for example, in this case I want to do a sinus lift procedure. If I have a rotary file to lift the sinus, the same drill virtually able to see, and you lift the sinus. The three numbers what you see there in the dart here is 0.3 millimeter at the side and 2.5 degree variance, because I earlier said to you not to explain, I'm showing it here. Real time you're able to see where you're drilling, how you're drilling it here. So this is a completely about the surgical protocol related to Navident here.